goes on. The beat goes on.
Drums keep pounding a rhythm to the brain.
We represent about 25 different cities and municipalities around southeast Michigan. As these revenues shrink and your legacy costs and healthcare costs go up, something's got to give. And so our firm really specializes in looking at the liability and then providing solutions to bring that liability down. A lot of this is just caused by demographics. And you have the leading edge of the baby boomers turning age 61 in 2007, the trailing edge turning age 43. By 2020, the age group of 55 to 65 is going to increase by 75%. By 2030, the people in your group 65 and older is expected to be the largest percentage of the U.S. population in retirement in America's history.
And the beat goes on. The beat goes on.
Drums keep pounding.
So what do we do? So we first get over the shock of that first meeting when your actuary sits down and gives you that report that says, here's your liability you have to post on your financial statements. I thought we were a small village. And this number looks like the national debt. What happens is then you've got this large liability that the actuaries give you. Typically, it's 20 to 50 times what you currently pay for retiree health care.
We all recognize that we have this liability. We also have, as we've mentioned, funds that we have been contributing to on an annual basis.
To the brain. La-da-da-da-dee. La-da-da-da-da.
And the beat goes on.
Yes, the beat goes on.
And the beat goes on.
And the beat goes on.
The beat goes on.
So, if your retiree health care bill every year is $500,000, you could have a $10 to $25 million OPEB liability that you have to disclose on your financials. You have to account every year 2 to 10 times that number. So if you're spending $500,000 a year on average, you might have to book every year $1 million. Now, I heard someone say you put $1.3 million away. Liability, that number will be eaten up in 1 year. So the next thing is you want to start working with someone that can help you bring that number down. And that's done through plan design. Because you will be asked the question of your taxpayers and the general public, what are you doing about your retiree health care? And most brokers out there, insurance brokers, really don't know the answer. So that's why a specialist like our firm is really equipped to help cities and townships and villages that most insurance brokers just don't have the capacity to do.
The beat goes on. The beat goes on.
Drums keep pounding a rhythm to the brain. La-da-da-da-dee.
We use these retiree medical savings accounts often, and we figure out how to direct this type of account into your negotiations, into your plan design. We identify the uses, we identify the tax consequences, the tax benefits. Again, this is where the typical broker really doesn't understand this. We work with group Medicare Advantage plans. Now, they're a Medicare-based plan that's new, based on the Medicare Modernization Act of 2006. And today was a tremendous discount. That number that I showed you, a $23 million liability, can be substantially discounted for that $1.3 million that you have set aside today if it's sitting in the general fund versus a retiree health care trust, separate and apart from the village. Several unions with different plans, so I have got copies that I'll pass through in a second. Employee benefit booklets that are tied to the different unions. We can set up an employee website. This is kind of a snapshot of our benefit book. But the employee website then allows you to go online as an employee to access benefit information. So we do a lot of those things that really help, from an HR standpoint, communicate the benefits very effectively. Cost containment, again, that's just part of our overall analysis as we look at different plans. We develop reports for, and I don't know if you're eligible for retiree drug subsidy, but we were one of the first firms to understand the retiree drug subsidy program that's now available through Medicare. So if you are currently paying prescription drug costs for your post-65 retirees, those that are on Medicare, you are eligible for a 28% subsidy, drug subsidy back from the federal government.
And the beat goes on. The beat goes on.
Overwhelmed.
Where to begin?
Yes.
I don't.
Let me ask you, if we decide that we want to hire you or we want to hire a service like yours, what is the next step to get started with that?
Right now, it did that for the benefit of smaller cities because it's already built into your premium, whether you use an agent or not. So I think in this particular case, and in a few discussions I've had with Renzo, you don't have to actually pay a dime out because it's already built into the plans that you offer. So
And the beat goes on. The beat goes on.
Drums keep pounding a rhythm to the brain. Light it up.
refresh my memory, how many employee contracts do you have with Blue Cross right now on health care?
We have 4 units, 40 something.
Including
48.
retirees?
Yeah.
The beat goes on. The beat goes on.
Whether you want to, bring them in at this point in time, or just at the very least you want to wait until the actuarial is done. But definitely I would suggest that it would make sense to bring them in and prepare for the next round of negotiations. No.
The beat goes on. The beat goes on.
Drums keep pounding a rhythm to the brain. La-da-da-da-dee. La-da-da-da-da.
And the beat goes on. The beat goes on.
Drums keep pounding a rhythm to the brain.